thank you. I received an invitation from the Health Foundation.
Yes.
And they have told me that they would like to me be aboard. So I'll
Yes.
be with you on that board. And
Yes.
hopefully together we can make some good.
Yes, I was so excited. They were Bill Biggs is a wonderful guy. I know you met with him, and
Yes.
and he is really great. Yeah. So I'm very happy. They did change the board meeting. It was going to be in May, and they made it to June. But that's right. You're the star, our star new nominee. I'm so happy that happened.
I saw it
Okay.
because of you. Thank you.
You're welcome. So this is since we weren't recording before, why don't you tell people just what you said about the COVID and why they probably should wear a mask, especially if they're an elder person or if they have any problems that might erupt.
Hi, Anita. How can I say hello to
Glad
you?
to have Dr. Jaffer. Sorry, Dr. Jaffer is the founder of the Senior Medical Associates, and we're going to do a wonderful interview as usual with him.
Hi, folks. You asked me the question about the vaccine.
Yes.
You see, the vaccine is meant to protect you, most of the people. Some people, it may not protect them, but they'll get a mild form of the disease and hopefully not fatal at all. But all in all, you get the percentage of efficacy. So today, Pfizer and Moderna is around 94, 95%. That means out of every 100 people, there'll be 5 or 6 people who will not be covered by the vaccine. We are very lucky that we have vaccines with such high efficacy, because in the olden days, the vaccine, like for example, the flu vaccine is only 70% effective. You see, so that means 30%, 30 out of 100 would get a flu. So same way here, 5 or 6 people out of every 100 can get the COVID infection. And more so than that, what I'm worried about is that in the state of Florida, we cannot ask anybody for a proof of vaccine. There's no vaccine passport. So, and the governor has said you can all do away with the mask. So what if I'm a young person, I have COVID infection, but I don't have any symptoms, and I'm going around spreading it out to everybody? That's my worry. And that's the worry of the medical community today. That we
Yes,
would have
I don't approve of what the governor did myself, but I'm glad that you don't either.
Well, I'm talking about medicine, and I'm sure politicians talk of politics. But this COVID infection is a medical problem. And I wish medical people were making decisions rather than political expediency. So,
Yes.
And I understand the governor's need for commerce and business to start again. So I understand his motivation. But today we need to protect people. If you look around the world, like India became complacent. They became complacent in February and March. They thought they had conquered the disease. And political rallies, religious functions, all started without masks. And today they are in a horrible second wave. And thousands and thousands of people are dying daily. And that's horrible, because I think protecting our citizenry is the prime directive for all the politicians. And they should listen to doctors and listen to the medical personnel and make the decisions. On the other hand, our Center for Disease Control, CDC, has made a decision that you can go around without a mask. But we now have to rely on people that only those who will take their mask off are people who have been vaccinated. What if somebody who doesn't want to get vaccinated, has not been vaccinated, does not wear a mask, and spreads the disease?
I agree.
That is a conundrum we have.
I know, because that was my question, that when I go to Publix, I am wearing my mask. When I go places, just like the theater now, they're opening theaters, I'm going to wear the mask.
I agree, especially for our seniors who have a lot of comorbid conditions. And if ever they get the COVID infection, they would be bad responders. You see, they would get more like a real disease rather than asymptomatic disease. So for them, they should be like you, Anita, wear masks until we have herd immunity in America, which means at least 70% of the people are vaccinated.
That may never happen either. Looking at the statistics, we
It is,
never have herd immunity.
you're hitting a very raw nerve. Unfortunately, there are so many people, because of political reasons or
Yes.
because of misinformation in the media,
Uh-huh.
they do not trust the vaccine, they are not taking the vaccine, and they're endangering themselves, their families, their friends, and society at large, unfortunately.
I have triplet grandchildren who are 15 and they just got their shots.
Oh, great.
Mhm.
Great.
So are you giving the shots out at the senior medical associates offices?
Up to now, the government has not distributed to doctors' offices. They have distributed to certain religious organizations, certain large medical offices, but not all the doctors' offices as a whole. And I feel that our offices, which caters for seniors, and we feel that more than 90% of our seniors are vaccinated, which is very, very good news, really.
Mhm. I agree. Well, let's now talk about when patients come in. Of course, you take their temperature, and if they seem okay, what are they continuing on their medication? Are they doing everything else they did, except of course they are now wearing a mask? How have their lives changed?
A lot of our patients, because they are vaccinated, are leading their lives normally, except for, like we told them with what you are doing, is when you go to crowded places, keep your masks on. This new directive is only a week old, but we said, you've got your vaccine, don't feel you are Teflon. Please continue to protect yourself, especially when you're among a lot of people.
Right.
But now CDC has given us a little more hope, because of studies show that vaccine really is quite protective. So I told them, among yourselves, your own family members, you can take off your mask, especially if everybody is vaccinated.
Okay, so now let's talk about somebody who has been feeling fine and all of a sudden they don't feel so fine. What are they going to have? What will be the first thing that they'll notice that's different if they have gotten the COVID, even if they've been vaccinated?
So far, we have found out that COVID has got multifaceted infection. It's a virus that might settle on your nose, and you start getting stuffy nose. You might get sore throat, and then you might start coughing, and it's going to your lungs. In the meantime, you might get diarrhea, and you might get headaches. And if the infection continues to rage in your body and is not defeated by your immune system, then you will get a fever. And that in 5 to 6 days will subside. Now, here is the catch, that you just felt like a small cold come on and it's gone, and nothing more happens. You are lucky. This is majority of the people. But then a lot of people, the 20%, after 5 to 7 days, they start feeling sick again. And this, ironically, is not the virus, it's your own body mounting a very, very robust fight against the virus. And they begin killing your own cells in your own body and drowning you in fluids, causing clots. So you get heart attacks, you get stroke, and you kill a lot of your lung tissue. And then you start getting so short of breath that you need oxygen and maybe even a ventilator, and you might even die. This is the spectrum of the disease. And that's why we have been very cautious with our seniors. And when the COVID infection became rampant in America, who were dying the most? They were seniors.
Yes.
65 and above were the majority of people who succumbed to this disease. Nowadays, of course, if you go to the hospitals, you'll see people between 30 and 50 now, because they have not taken their vaccines. But the older generation is not there in the hospital anymore because they are by and large protected.
That's great. Well, let me just take a second here. And this I was going to say witness. My star interview is Mohsin Jaffer, Dr. Jaffer. He is the founder of Senior Medical Associates. Let me give you a phone number to call because you just get your paper out and make sure it's a place that you'll always know, because they have offices all throughout Broward County. So he should be your doctor. I don't know who you go to now, but let me just tell you, once you meet him and you meet his staff, you don't want to go anywhere else. And their phone number is 954-659-9690. Again, that's 954-659-9690. Or you can get on their website, which is seniormedicalassociates.net. And they are everywhere: Coconut Creek, Coral Springs, Deerfield Beach, Hollywood, Pembroke Pines, Plantation, Oakland Park, Sunrise, Tamarack, Weston. Doctor, since you founded Senior Medical Associates, Dr. Jaffer, where did you start out? You had one office when you first started, and how many years ago was that?
Oh, time passes fast. We've been in Broward County for about 30 years. I was in Miami Shores before. And so we started in Pembroke Pines, and then we expanded to Weston and then all over Broward County. We felt that Broward County is our home, and we need to provide for the citizens of Broward County, the senior citizens, 65 and above.
Right.
So we are mainly
65 and above, but someone comes in, they need help at 55, you take care of them.
Unfortunately, no, but we are planning to open that door.
Oh, are you?
Yes, but we feel that 65 and above needs specialized care. When you're very young, you go to a pediatrician.
Yeah.
When you get to the older age, it becomes a specialized group also. And their requirements are different. You need a different mentality of doctors, because seniors have multiple medical problems. They have multiple medications. They have a hearing problem. They have a retention problem.
Yeah.
You have to deal with them differently, and you've got to spend a lot more time and also understand how their body responds to medicines and treatment. They are different from a young man or a young woman. So our doctors have to be tempered with that mentality of geriatrics. Geriatric medicine is a lot different from medicine for younger people.
That's true. I know that so well. That's what I've been trying to tell people for a long time. But let's just focus on one particular situation, which I think is quite important. Let's talk about, we've talked before about breathing, but I think we need to talk about, and you've done this, but I want to go over sleep again, because I've been reading a lot of books on memory. I have a new book, was just called Remember, which is a fabulous book. It's by a neuroscientist, and some people feel they're getting Alzheimer's, they're getting all sorts of memory disorders, when it's not. They can help themselves. They just have to do things that they have to write things down. They have to remember things that they can remember, and it isn't because they're going into Alzheimer's. So why don't you kind of cover this a little bit in the time we have?
We raised two topics about memory and sleep. You want me to
memory
talk about
and sleep.
Sleep, okay. Sleep is such an essential part of our life. We look at sleep as a waste of time because we're not conscious, we are subconsciously asleep, and we are not awake. And our mentality says that out of 24 hours, if I sleep 8 hours, 1/3 of my life is wasted on sleep. I could be watching TV or talking to friends or doing things. Unfortunately, the late night TV show has cost America a lot because we do not get enough sleep. Studies show that we need 7 to 9 hours of sleep. If we don't get that, our body suffers tremendously. Why is sleep so important? You see, like I tell you, you buy a Cadillac, in 20 years is junk, right? But your body can last 120 years. and it's rejuvenating itself, it's fixing itself, it's renewing. My skin cell changes in 1 month, the whole body, 15 pounds of them, all body changes in 1 month. And my blood changes in 3 months, my bones remodel, my brain cells remodel. So when is this taking place? It's happening at night. The wear and tear of the whole day. At night, my body now is resting, so it goes and looks for broken cells, damaged cells, toxins, metabolic residues, because we are big chemical reactions. Billions of chemical reactions happen every day in our body. Everything I'm doing just now is a chemical reaction. Me talking, moving my hands, moving my mouth, moving my tongue, thinking. Everything is chemical reaction. So at the end of the day, when I'm resting, my body is repairing myself, healing itself, and taking away all the broken byproducts, and also killing cancer cells. Every day, you and me are making multiple cancer cells. These are renegade cells which are mutated, not exactly according to the, the prescription of our DNA, and they have modified. But the body can recognize it and say, you're a bad boy, and kills them. So all this work is done while I'm sleeping. So now we must all look at sleep as a very, very important factor of life. So now that I respect my sleep, I will make sure I sleep enough. And what is enough? 7 to 9 hours of sleep. So the mean is about 8 hours. So
okay, so let me ask you a question. Let's say you don't get enough. Can you take a nap of an hour or two during the day? Will that be okay?
It helps, especially for seniors who run out of energy. So, you woke up early in the morning at dawn, and then after lunch, you're feeling as dopey. Take a half an hour nap, take 1 hour nap. It'll rejuvenate you, get you a little more energy so you can last until evening. But I recommend very strongly, not I, but scientists, we have discovered this, that the best important thing is that you sleep at the same time and wake up at the same time. Let your body get used to that rhythm. And don't change it in the weekend to say, oh, I can fool around, I can sleep late, make up. There is no makeup. You can't have few nights of low sleep and then in the weekend you sleep for 10, 15 hours. You can't make up. The damage is done. Every day repair must take place. If it's not, it's sustained and it's just accumulative. So we have now recognized, number one, that sleep is important. Number two, the timing of the sleep. If your body is used to, let's say I usually go to bed by 9:30, and by 10 I'm asleep, and at 6 o'clock promptly, alarm clock or no alarm clock, I'm awake. And that gives me my 8 hours every day. People say you're acting like an old man. I say, it doesn't matter. This is how we were when we were created. Light was just invented by Thomas Edison just so many decades ago. But when you think about it, in the old days, when it got dark, we all went to sleep.
Right.
We woke up at dawn. That's our circadian rhythm, the rhythm that Mother Nature has placed within us. This rhythm of sleep and wake up cycle is inbuilt with us. We fool around with it. We try and modify it, much to our disservice and damage. So let's go back to what Mother Nature has programmed in us. This idea of a circadian rhythm. So once you appreciate that there's a rhythm in our body, even people who sleep late in the night and are asleep at dawn, their body wakes up. Their blood sugar goes up, their cortisol level goes up, and the body is acting as if it's going to wake up, but they don't wake up. People who have high sugar problems, they'll notice that early morning their sugar is high because the body is preparing for them to be using that sugar, you see. So there is ample evidence in medicine to show that there is this rhythm, and it is best to comply with this rhythm and not to disturb it. Number two, you have to prepare for bed. I told you I go to bed by 9:30, but I am asleep by 10. It takes time for you to fall asleep. So what are the factors that stop you from sleeping easily? Most important is blue light. You see, Mother Nature has sunlight. By dusk and by nightfall, there is no light. It's pitch dark. And your body senses that and produces melatonin. And that makes you go to sleep. But if you got a light coming in, especially blue light coming in, your body says, wow, it's still daylight, it's morning. So no melatonin is produced, so you don't feel sleepy. So blue light is from your phone, from your TV. So all that is not good. Even your phone, you can change the settings on it nowadays, and that lets you sleep and no disturbance also. So you are now cutting out the blue light. Number two, you can't be mentally excited. If I watch a horror movie or a thriller movie, my mind is wired up. I can't go to sleep.
Right.
So you've got to slow down. You have to get into that mood. So you could be reading, which is very good, okay, for falling asleep. You prepare your room also. Temperature helps you a lot. You must reduce your room temperature. 69 to 72 is a good temperature to sleep in.
Really? That's pretty cold for me.
Okay, then you put in a higher temperature. But this is what the human body does very, very well. Because if it's really cool, and you can put in a little blanket if you want, but your body senses the cold temperature, you sleep better.
Interesting.
Yeah. Also, you can't have a very full belly. You can't sleep very easily. So you want to finish eating at least 2 to 3 hours before bedtime. Don't have a very, very full belly. Because when I'm sitting and I'm standing, my food falls down. But when I go to sleep, the food can roll up, especially those who have reflux. So you start getting acid in your mouth and you're uncomfortable. Okay. Number three, I would say pillows. A lot of us use 2 pillows. Big mistake. Remember that the gap between my back of my head and my spine is only about this much. Okay. So you must have a thin pillow. You don't need
Really?
very thin.
I do use big pillow. You're saying that you'd have my small pillow?
Because think about it, if I'm sleeping nice and straight, I have a very little space here. But if I put a big pillow, what have I done? I put a crick in my neck.
Yes.
That's why we say you are a pain in my neck. It's the most common pain in America today. The spine pain is the most enduring pain in the backs, the lower spine and the upper spine, which is called the cervical spine. So you're really taxing your neck. And as it is, we're all on computers, we are on our phones, so we're already bending a lot. Now you're pushing it even further. So ideally, you need a very thin pillow. And
oh my goodness.
Is a no. Okay. Also, 2 pillows puts a bend in your stomach, so more pressure and therefore more reflux. So more than half of us have a very weak sphincter of our stomach. So whatever food goes down sometimes starts coming up. And food in the stomach is acidic. And that's the only place your body can accommodate acidic food. Your saliva, your esophagus is all alkaline. So if acid comes up, that's when you get heartburn. Okay. So all these things induce you not to sleep easily and well.
Okay, so I'm going to stop you. I want everyone to know who my wonderful guest is. Boy, I always learn when Dr. Jaffer comes on, but this is Dr. Moshe Jaffer, and he is the founder of the Senior Medical Associates, Leaders in Senior Healthcare. And I want to give you their phone number. It's 954-659-9690. And it's seniormedicalassociates.net. Before you get off that subject, how about urinating at night? It seems like I always wind up having to get up once or twice when I go to sleep. So what about that?
It's a good question. Urinating at night is a big problem for our seniors. You know, all of us wake up in the night once or twice to go and pee. So I will answer that question. Let me just get into the sleep mode first, because this is
Okay.
interruption of the sleep.
All
So
right.
you have prepared yourself. So it will be a good idea to go and empty your bladder before you go to bed. Also, brushing your teeth helps you a lot, because that bacteria multiplying in your mouth is very, very bad. They are the cause
Right.
of inflammation, heart attacks, strokes. In fact, the latest study just shows that if everybody brushes their teeth after every meal, you will cut down heart attack rates by 20%
Really?
just by brushing your teeth after every meal. And
Why is that?
because the mouth bacteria are now implicated in influencing your gastric bacteria, I mean your gastric biome, and also it is a harbinger of inflammation in your body.
Huh.
And heart attacks and strokes are all related to inflammation. Fire in your arteries where you get clots, and a clot is a heart attack or a stroke up here. So pee before you go to bed, brush your teeth well, do flossing, okay? Because we have things left behind between our teeth where bacteria will break it down, make it acid, and eat your teeth away. But more so than that, bacteria will multiply because you gave them food, you see? So if you have clean mouth, less food for bacteria to multiply, and you have very small population in your mouth of bacteria.
Okay.
Also,
Great.
your tongue. I would advise people to scrape their tongue. I know it sounds a little gross, but it's a very good practice.
I never scrape my tongue.
Scrape your tongue. You'll be amazed how much gunk comes out of that, okay?
What do I do it with my toothbrush?
You can do it with your toothbrush, or you can have a simple scraper. It's $1, and you just scrape your tongue. And some people gag, but if you stick out your tongue, then it's less chances of gagging, and you just scrape the bacteria off your tongue. Your tongue is very rich in a lot of growth of bacteria and residue from your food. So that's another point. So now you have prepared yourself, you made your room cool. Some people live in noisy neighborhoods, or they have live near a road where they have traffic noise or neighbors noise, so you can put white noise, soft noise of waves or rainfall or forest or whatever turns you on. You can buy simple apps on your phone that could work, or you can buy a CD or whatever, and this soft noise drowns out all these extraneous noises which could wake you up and disturb you. Now you're well prepared, dress comfortably also. I recommend sleep naked.
I sleep naked.
That's right. If you sleep naked, it's so much better because you use a little more energy, and it's good for your skin, and it's good for your feeling. It's very nice. Mother Nature made us naked, so it's not a bad idea.
I love this.
But it's a good idea. So you're comfortable at least, or you're naked and you are well covered for your blanket so you don't freeze, but you are
Right.
cool, quiet, peaceful environment, and you fall asleep. And you're not thinking of any bad thoughts. You have calmed down, you have read something pleasant, and you fall asleep. And then lo and behold, 2 o'clock in the morning, you're awake because you got to go to the bathroom.
Yes.
So I've got a very important advice to all my seniors.
Okay.
So many hips are broken because they wake up at night and fall down and break a hip.
Mm-hmm.
So first thing, you break up when you wake up from your sleep to go and pee in the bathroom. First of all, because you peed before going to bed, chances are less. But men have a prostate, women have smaller bladders or irritated bladders. There are a lot of conditions out there that make you pee again and again. So you are forced to wake up. So I would recommend when you when you wake up, swing your legs over the bed and sit by the bedside for a minute,
Mm-hmm.
so that your pressures equalize and your head is not empty. So when you get up, you don't get dizzy and fall down. Okay?
Mm-hmm.
Very
Right.
important point. Number two, I would request all your viewers to keep a big jug of water with a big glass of water by your bedside. As soon as you wake up in the middle of the night, drink a big glass of water.
Really?
Yes, I'll explain you why. And then you go to the bathroom and you pee and you come back and you go to sleep. The beauty is that when you are standing up, a lot of your blood is in the lower limbs. As you get older, your circulatory system is not so efficient. But when you lie down, then all the blood will come back to the heart. So you can pump to the kidneys, and a lot of your excess fluid is thrown out. And that's why you want to pee. But you are dehydrated now. And if you don't drink enough water, that's why the number of heart attacks and strokes is most in early morning, because you are dehydrated. When you are dehydrated, your blood gets a little more sticky, therefore more chances of a clot in your heart or in your brain.
See, I thought if I drink that water, it's going to make me want to pee more.
Well, that is a compromise now. If you have a medical problem or you have a heart problem or whatever, prostate problem and so on, you may be told to drink less. But if you don't have all those things, I strongly recommend you to drink. Because when you wake up in the morning, you'll go to pee again in the morning. Drink another glass of water. Dehydration is the biggest enemy of seniors in America today.
And Dr. Jaffer, we never have enough time with you. If you have the time, this would make a great article. I would like to almost do a series so I could do it in maybe 2 or 3 articles. I love it. Sleep Naked could be the title. But anyway, that'll get people's attention.
That sounds fun, yes.
So thank you. I really appreciate you never have enough time with you. You are so sensational. So I remember a lot of the things you said, and I hope that people are listening. And if not, we're going to send this out. Maybe they will listen. But I'd like to write some of these things down, Dr. Jaffer. They were extremely wonderful. And thank you so much.
My pleasure.
Okay.
I can tell you more about the sleep, the rhythm of the sleep while you're sleeping. And the cycle. This is called the REM cycle.
Okay. We can do that maybe next time when we come on. We'll continue this as a series. That's excellent, extraordinary information. I don't have anyone who said all the things you did. So thank you. So we're ready we're out of time, right, Dan?
Yes, ma'am.
Wasn't that wonderful?
Certainly a pleasure.
So do you sleep naked?
Do I?
Yes.
No, but I'm going to start tonight.
I sleep naked. I really do. My husband and I always slept naked. It was just what we did. But every once in a while, if I'm a little cold, I put a shirt on, but I don't put anything on anywhere else. But I think it is very good. So we're going to do an article if Dr. Jaffer can. I know he's very busy, but I love your articles.
Yeah, well, Dr. Jaffer, I'm a well-endowed heart patient now. I just had 2 stents put in 2 weeks ago, cardiac stents. One was in the Widowmaker, so kind of opened my eyes a little bit again. But you made so many just incredible points today. So I follow your advice, sir. Hats off to you.
Yeah, we're going to get shut off. We're not rude if we get shut off, Dr. Jaffer. It just does that. But that's good, Dan. Yes, I'm going to start doing. I'm going to have a bottle of water by my bedside, just like you said. I'll drink it. That's all.
And that's a great point, Anita, because I thought, well, gosh, if I drink during the night, I'm going to have to go more. But Dr. Jaffer made an excellent point. There's a balance. You have to weigh the good against the bad, and
so true. Yes.
I don't think that I can get ready for bed at 9:30, though. I think 10 o'clock is going to be the earliest. But my husband lived to be 93, and he was religious about going to bed at 10 o'clock, always. And even if we had people over, he'd excuse himself, get in his pajamas, or get into something, and he's gone. And that was it.
That's great. Well, and he lived to be 94. So
right.
The proof is in the pudding.
And I'm going to wave you goodbye with my beautiful rose for you. You deserve it. Thanks for all the information, Dr. Jaffer. It's always such a pleasure to have you with
It
us.
was a
And I'll
pleasure.
see you on the board of the,
Yes,
of the Broward Health. I'm so
Congratulations.
happy.
thank you. We'll make some good work together.
The Broward Health
Okay, I
Foundation is
appreciate that.
honored,
Okay,
really.
okay. Goodbye, everybody.
Thank you, sir.